again. I'm Janna Baker. I am a physician's assistant for the past 13 years. Currently at the Hamilton Mill location, and I live in Athens, so I will be at the new location in Bogart, which I'm super excited about. But I still love my Hamilton Mill people, so hopefully I'll still be back and forth a little bit. But yes, I am here today to talk to you all about Botox, one of my favorite products on the market. Basically, it's my gateway drug to aesthetics. So with Botox, what it is a neuromodulator that helps relax wrinkles, and it's a temporary paralysis of any muscles. And where we predominantly put it aesthetically is in the face and neck. So it was designed I think in 1970 as an alternative to eye surgery for strabismus. And so people with a lazy eye, it just helped with their musculature there. And they found that, hey, look, no wrinkles on the corner of your eye. So then led into aesthetics. And it was, I think, approved for aesthetics in 2002. Of course, the Hollywood started it in 1997. So the stars, of course, took over first before it was FDA approved. So now we are lucky in that we can now use it for slowing the process of aging by relaxing our face, making us look more awake. Now, a lot of times I get patients that are very skeptical about Botox because they get a little bit confused with filler and Botox. We will talk about filler, but for Botox, it's not going to change your appearance. It's only going to make you look more relaxed and refreshed. And some of the areas, I'll go ahead and pull up some slides, and you'll have to tell me if you don't pull them up because I can't see them on my end. But the first place, we're going to kind of go from top to bottom and to the neck is where we put it aesthetically at about face, the amount that we use, and about how long it lasts. So Botox, one of the most common areas that people come in first is for their forehead lines, and they're between the brow. If you look very angry or if you squint a lot, you get these, what they call the 11 lines. And that just kind of makes you look older and angry. And so a lot of people want to come in because they want to look more, they literally come in and say, people think I'm angry or like mad all the time. And so this is kind of where we put the bulk of a product. So in this area, you are going to get a little bit more to relax that because it's a bulky product, a bulky muscle that brings our eyebrows in and pulls our brows down. So to relax and open that area, we typically do anywhere from about minimum of 12 to up to 30, depending on the person and how strong that muscle is. And that's going to like lift your eyebrows up. The other area we put it in the forehead is in our forehead lines. This is a kind of a trickier area to get those brows to keep them nicely lifted, but also those lines relaxed. Like, it just depends on the person. So we typically, I don't really give a range as far as, you can go from 6 to 20 units in your forehead. It just depends if you want frozen look, relaxed look. Do you want an arched eyebrow? Do you want full smooth forehead? It just depends on the person. And sometimes it's like a recipe that we have to tweak to get it perfected for you. So I always start a little bit conservative and then increase in 2 weeks at your follow-up. The other place is the crow's feet. So around the orbicularis oculi, that is a circular muscle around your eye. That when you inject Botox here, not only does it relax the crow's feet, but it also allows your eye to open. So when you smile, it doesn't pull in and give you that squinty eye. So people really like that. Other areas you can actually inject into if you have a little, we call it the jelly roll under the eye, 1 to 2 units around the eye. If you've got the little bunny lines, the creases in your lines, I actually did Botox recently. And so I don't have them right now, but usually I do. You could do the down here to keep it from pulling up. If you have a gummy smile, you do it here. If you have pesky lip lines, or if you want to keep your lip looking a little fuller when you smile so it doesn't retract up, you do what's called a lip flip, or treat the lip lines. In this slide, I actually treated the corner of my mouth. So these are called our depressor anguli oris. So that's the corner of your mouth right here that pulls the corners down. So that gives you kind of that frown line or the grumpy cat look. In the first picture and the before, I am making the face to try to pull my mouth down. And the second one and the after, I'm not able to. So it gives you that really smooth appearance to the corners of your mouth. The next one, these are all me, so I'll take criticism. But this is actually a picture of after I treated my corners of my mouth, my chin, and my lip above. And so this, you could see it just really smooths that area, elongates the chin to kind of relax it, because as we age, our mentalis muscle, which is right here, starts to pull and curl up as we lose a little bit of bone along our chin. So it just gives you that deep crease on some people. Others, it kind of gives you that orange peel effect, or just looks kind of shortened. And so doing the corners of your mouth and chin help just elongate and help with that jowling process, as well as kind of giving you a nice smooth appearance to your chin. And then this is the last picture of myself. So if Chrissy likes to tell, I do experiment on myself because I'd rather experiment on me and make it bad versus a client that is paying. But this is actually when I treated my necklines. I have looks like tree trunks on my neck. And so just to see the before and after, I actually sent this to my mom and sister. I treated one line, and you can see in the picture on the right, my right now, that I only treated one, so you can see that other one disappeared. And when you entreat the entire neck, so if I were to treat it all around, it is very smooth. And that just gives you a sharper jawline. It's actually called a Nefertiti neck lift, which I don't know where people come up with all these names. If you treat along the DAO, the chin, and the jawline, as well as the neck bands, it just kind of gives you a sharp, more defined jawline. And not everybody's a candidate, but that is one of the things that you can do if you're not quite ready for filler. Other areas that we can do it in are our underarms. If you have profuse sweating, hyperhidrosis is the medical term. We typically do about 50 units on each side. It lasts about 6 months under the underarms, as well as the jawline. If you have like bulky jawline, you want to slim the face, or if you clench really hard and you've gotten these bulkier muscles, that really helps relieve tension, but also slims the face. And that usually requires anywhere from about 16 to, I've had 50 on each side for my own jaws for TMJ. How long does Botox last? So it depends on where you place it. In the forehead, upper face, where you have less mobility, it's going to last about 3 to 4 months. 3 on average is about the time that you would want to schedule your next appointment. Some people, if you exercise a lot or metabolize quickly, exercise and eat quite really well, take stimulants such as Adderall, you might find that it's wearing off more quickly for you. Lower face, because of the increased mobility and the lower numbers that we put in the lower face, it might be more 6 to 8 weeks. Contraindications, pregnancy, and also if you have any neuromuscular issues with the face, like as myasthenia gravis, and there's no long-term side effects that we know of yet, so it's fairly safe. Local effects only. Might have a little bruising and swelling, but other than that, there's not a lot of adverse effects. And if you don't like it, unfortunately, there are a few people that come in and say they've had a drop brow or something like that. Everything does go back to the way it was before. It wears off again in anywhere from 10 to, I don't know, 4 to 5 months. I used to go 6 months. So it depends on the person and your metabolize. But that is my favorite product, as you can tell. I can talk to you about it all day. And if you have any other questions, just chat me up, private chat, or on the other chat, and I'll answer it while everybody else is talking.
Janna so you do something for 22, 23 years and you think, oh, I know it all. Janna has taught me so much about the creative uses of neurotoxins.
On myself.
on me. She's done things for me. And I'm like, I never knew I could do that. So yeah, she is wonderful with Botox and filler and sclerotherapy and lasers and all the things. So thank you, Janna. Thanks for donating your own pictures. I love this picture with the one band gone back and the rest of them over there.
I wish I had the whole one, but I don't have that one.
Yeah, that looks great. All right. And Janna, I'm going to let you come back in a minute to talk about Skin V for us. I think today I did Skin V on 4 people, and I think yesterday was probably 5. It is so popular, and I have to say it is my new favorite. I love it.
Yes, I would agree. I do love Botox, but Skin V is close second as far as my favorite injectable. I also did about 2 or 3 patients today, and What I love about SkinVive is one of the clients that I had today was very, no, sorry, one of the kids are right here, moving my camera. But one of my clients today was very nervous about starting a filler. But the good thing about SkinVive is that it's not it's not a volumizer and augmenter, so the risk of migration and having unwanted side effects, like you see people with like lumps or bumps or they're really full. She mentioned she was scared to death like Jennifer Aniston, so we were all talking about that right before the presentation, how she just looked like something had been done. And so we want to avoid that. And what SkinVive is an internal hydrator. So it's a hyaluronic acid injectable that internally hydrates the skin instead of external hydration, like with a hyaluronic acid that's topical that washes off at night. So SkinVive is an injectable. And so it is, I'm sorry, I have a crying child.
Oh, I can take over, Janna, if I need to.
Go to daddy. I know. Go. Sorry. They opened my bedroom door. Okay, to dad. But anyway, so I'll try to finish this real quick. So SkinVive, one of the major areas that it was designed for is for hydrating the cheek to really give you a glow. So in younger patients, specifically what we've been seeing is that it's going to give you this lighter, brighter, hydrating area. So you're going to see this nice, beautiful glow because you see in the before picture and the after. She almost looks like she has a serum on her skin. And you can see, like I've had it as well. And I don't know how, I don't have the before picture, but I can definitely tell when I smell it's a lot less crepey. But one of the main areas that I've actually started really enjoying injecting it in is around the crow's feet. So these lower crow's feet, for when you smile, they're at the top of the cheek, and it's usually from lack of volume and hydration in the skin in this area. So injecting the hyaluronic acid, it's a honey-like consistency. So you're going to put it right here. And it's going to make it, instead of like a collapsible crumpled bed sheet, you're going to become a little thicker comforter. So you're not going to have that like easy crease. And so that is just a really nice addition to Botox treatment for the crow's feet. Another area is the smile line. So you can't put a lot of like heavy filler here because there's no muscle, there's no bone here. So that mobility is really going to make it look like nodular if you put too much filler here. So the SkinVive has been a nice addition. And this is our beautiful esthetician, Miss Barry, who's going to come on later. And you can see in the before picture, I mean, she has great skin, but in the second one, it's just much softer, supple and shinier, but also just in the smile line areas, how much improvement she's gotten in that smile line and softening of the crow's feet. But I didn't put a ton right here because we had just done Botox as well. But she did get some really great results in that area. And the other thing we have been putting in is around the mouth, the perioral lines, those pesky lip lines and smoker's lines, as well as like around here, we have the superficial lines. Heavier like voluma or a heavier product with more concentration of hyaluronic acid is good for like deeper lines or volume loss. But this client of mine, I have loved sharing this picture because our intention was just basically to hit the superficial lines. But what it also did is it lifted that gelling process that she had from some significant weight loss. And so you could kind of see how much improvement she just had through here. It's also softened her lines. SkinVive is, it says every 6 months, but she is 9 months out and we still haven't done it yet. And I think she just bought her next one for the next 2 months, but you can do 6 months or you can, wait a little bit longer if you're still seeing the effects, which we are even starting in a year out now. And then you can also layer it. So if you come in and we do a little bit of crow's feet, let it settle and you still have a few lines, we can layer at your 4-week follow-up. We can put another half a syringe to a syringe in that area and layer anywhere. And you can pretty much put it anywhere. I've put it in the little bitty like commas above the brow that are really pesky that doesn't go away. I don't even think mine are still there from Botox. But this is a little bit more of a spicy area that we don't do as much. And then the other place that we're finding has great results as well is our lips. So this client didn't want a full pouch. She just wanted more hydration and a subtle volumization of her lips. And you can just see how much more beautiful they are. They're much more hydrated and supple. And so that is the what we're seeing with SkinVive. It's not just as intended just for the cheek to glow, but it's also helping those fine lines and wrinkles. It also promotes collagen production, so it's going to tighten even after it's been injected. It takes about 4 weeks to see the final result, but at that point, if you still want a little bit more, you can again layer it. And then we also added on to your Botox appointment. It takes about 10 minutes, honestly, to do the SkinVive. It is multiple little injection points with micro droplets of the product. But yeah, that has been Botox and SkinVive are two of my favorite things. So I was excited to talk about them today. And I apologize for that little interruption. I got a little
no, never
got a little off
apologize
what I
for
was
that,
saying.
baby girl. She can come join us. That is your girl that loves our ice roller, right?
Oh, yes, yes, yes. She is it's literally around here every day. It's somewhere different. She pulls it out of my freezer and just rolls everywhere. She loves
She's
an ice
even
pack.
in the making.
Yes, yes. And loves sunscreen.
Yeah, yes. She's a very healthy little one.
Yeah.
Thank you, Janna.